So your father was just diagnosed with metastatic prostate cancer, and obviously you're concerned for his health. But you might also start thinking, what does that mean for me, or my brothers, or my children? In this episode, we're going to talk about high-risk prostate cancer and personalized screening for those individuals and families that might need screening at an earlier age or screening more frequently. So, who are the families that might benefit from a personalized screening program? Some of the criteria we use would be if your family has prostate cancer or any cancer at an early age. Earlier than 50 is definitely uncommon for prostate cancer, and even prostate cancers diagnosed before the age of 60 will be a red flag for a urologist or a medical cancer specialist. Also, if there are multiple members of the family who have had different cancers, particularly prostate, breast, ovarian, bladder, colon, rectal, these cancers are often associated with certain inherited cancer syndromes. You've probably heard about hereditary breast and ovarian cancer. You may have also heard of something called Lynch syndrome. These are famous cancer syndromes to doctors. The first one, breast, prostate, ovarian, and pancreas, that travel with a gene called BRCA. The other one, Lynch syndrome, which you probably don't know as much about, is really, Lynch syndrome is a collection of increased risk for colon or rectal, bladder, or uterus cancer, but also less commonly breast and prostate cancers. Those are the most common. If you are someone who wants to know the name of the genes, BRCA, 1 and 2, ATM, MLH6, MSH6, things like that. But those are only a Google search away. Really what we need is a good family tree. And if we look at the family tree, then we can talk to you about the risks and benefits and whether or not you want to proceed with germline DNA testing. That's looking at your DNA that you got from mom and dad, and if there's an abnormality that we call a pathogenic variant, a misspelling in your DNA that would predispose, not guarantee. Predispose means you may be more likely, but it's definitely not a contract. Having a risky gene is not a guarantee of cancer. But if you have a risky gene, we may want to offer you more intensive, more frequent screening for cancer. And in this case, we'd be talking about prostate cancer screening with PSA, with MRI, and maybe some newer techniques that involve DNA and blood testing. So to recap, when families have someone with metastatic prostate cancer or an early death from prostate cancer, they may be appropriate to ask for genetic screening. And if the genetic screening is abnormal, you may want to pursue a more aggressive or frequent approach to prostate cancer or even other screening for cancers. Personalized screening is really valuable. I think that screening is great for populations, but it's even more valuable when we can tell someone you need more and tell someone else you need less. Also, this kind of screening has implications for treatment. Should you actually be diagnosed with a cancer, sometimes these genetic variants may change the treatments that we offer you. So don't be afraid to talk to your doctors about your personal risk, and should you be pursuing a personalized screening and prevention plan, or should you just follow the standard path for average risk individuals. Thanks so much. Don't forget to share this video with friends and family if it's helpful. Have a good day.